Welcome to our video on hip flexor anatomy. In this video, we will explore the intricate muscles, tendons, and ligaments that make up the hip flexors and their importance in our daily movements. The hip flexors are a group of muscles located in the front of the hip joint that allows us to bend and flex our hips, pull our knees towards our chest, and rotate the hip joint. These muscles are crucial in everyday activities like walking, running, and climbing stairs. The main muscle of the hip flexors is the iliopsoas, which is made up of two muscles, the psoas major and the iliacus. The psoas major originates from the lumbar vertebrae, and the iliacus originates from the iliac crest of the pelvis. These two muscles come together to form the iliopsoas, which inserts onto the femur bone. Another important muscle in the hip flexors is the rectus femoris, which is part of the quadriceps muscle group. This muscle is located in the front of the thigh and attaches to the pelvis and the patella, kneecap. It plays a key role in knee extension and hip flexion. The hip flexors also consist of smaller muscles, such as the sartorius, tensor fasciae latae, and the pectineus, which help in various movements of the hip joint. All these muscles work together to provide stability and mobility to the hip joint. The tendons and ligaments in the hip flexors are equally important in maintaining the stability of the hip joint. The iliofemoral ligament, also known as the Y-shaped ligament, is the strongest ligament in the body and helps in preventing excessive extension of the hip joint. The hip flexor tendons, such as the iliotibial band, ITB, and the inguinal ligament, also play a significant role in maintaining stability and protecting the hip joint from injury. Now that we've covered the anatomy of the hip flexors, let's talk about why it's essential to keep them healthy and strong. Poor posture, sedentary lifestyle, and lack of exercise can cause the hip flexors to become tight and shortened. This can lead to pain and discomfort in the hip area and can also affect the alignment of the spine. Furthermore, tight hip flexors can also restrict the range of motion in the hip joint, making it challenging to perform daily activities or exercises properly. It can also lead to lower back pain, knee pain, and even affect your gait and balance. Therefore, it's crucial to keep your hip flexors flexible and strong, and incorporating targeted exercises and stretches can help achieve this. Some of the best exercises for hip flexors include lunges, leg lifts, hip flexor stretches, and squats. These exercises not only work on the hip flexors but also engage other muscle groups, leading to overall strength and mobility. Regular stretching and exercise can also help improve your posture and prevent back pain. It's also important to avoid prolonged sitting and try to take breaks to stretch and move around throughout the day. This will prevent your hip flexors from becoming tight and shortened. In conclusion, understanding the anatomy of the hip flexors is crucial in maintaining their health and functionality. Incorporating targeted exercises and stretches in your daily routine can go a long way in keeping your hip flexors strong and flexible. So, click the link in the description to learn more about how to unlock your hip flexors and improve your overall mobility and posture. Thank you for watching, and don't forget to like, share, and subscribe for more informative videos on anatomy and fitness. For more information, click the link in description.